for today. Our guest presenter today is Laura Lagendijk. She's a certified NVivo trainer and has 15 plus years experience leading academic and applied health research and evaluation teams and projects, teaching them how to use NVivo and how to apply it in their work. Welcome, Laura.
Thanks so much, Kevin, and good afternoon, everyone. So today I'm coming to you from a small town south of Calgary in Alberta, Canada, in the foothills of the Rocky Mountains. And I'd just like to start by saying I have been working with NVivo since long before it was called NVivo, from the late 90s, and then watched it evolve over the years. I've used the software in qualitative and mixed methods research projects when working in academic healthcare research. Then I moved to working in the healthcare system and brought my NVivo software and skills with me and continued to use it to support my work in knowledge management, evaluation, and consulting. Along the way, I began to train others to use NVivo informally as part of teamwork and more formally in workshop settings. So just starting with the basics, in case some of you aren't too familiar with NVivo, it's a software that supports your work with qualitative data and in mixed methods projects. In Windows, NVivo 11 is available in 3 different versions: Starter, Pro, and Plus. NVivo 11 is also available in Mac. In this presentation, I will illustrate the examples shown using NVivo 11 Pro. And it's important to note that not all of the features illustrated are available in NVivo 11 for Windows Starter or in the Mac version. And if you're interested to compare the features available in each version, a chart is available on the QSR International website. So, Kevin, just trying to advance my slide. There it goes. Yeah. So the purpose of today is to illustrate potential uses of NVivo 11 in healthcare settings. From my work using NVivo in the Canadian healthcare system, training others how to use NVivo and hearing about their projects, I have examples of many different ways that NVivo can be used to support and improve analysis of qualitative data. I've often noticed that people assume that NVivo is useful only for research, for certain kinds of methods, and so on. So if you're a person who also assumes that NVivo is a tool that's only useful in qualitative research, I am here to expand the horizon. Today I will illustrate many potential uses of NVivo 11 in healthcare settings beyond academic research, including policy analysis, literature reviews, environmental scans, survey data, evaluation, quality improvement, and talk a little bit about report preparation and how I've used features of NVivo to engage stakeholder interest in the data. Let me also note that this presentation is not a training session. I will describe some of the ways that I'm familiar with NVivo being used and sometimes quickly demonstrate some examples in the software. But I will not be spending time on the details of how to do these things in NVivo. The purpose of today's session is to show you the possibilities. If you are interested in training, I will provide resources for that at the end of the presentation. So a brief agenda for today. Pretty soon I will open NVivo, and I will alternate a little bit between the PowerPoint slides and showing you the examples in NVivo. Once I have NVivo open, I will first of all give you an introduction to some of the key terms that we use, and then I will talk about and show you using the software where NVivo can be used in a variety of activities that commonly take place in healthcare settings, when at different stages of the work process, how I think the use of NVivo improves qualitative and mixed methods work, and finally we'll give you a chance to ask questions and provide you with contact information. So, where NVivo can be used. In a moment, I'll switch to NVivo so you can see some of the examples of what it looks like and how we do some of this work. But if you were one of the people who thought NVivo was software that was only for research, I would like to expand the concept. From my own experience, some real-life examples of healthcare projects that used NVivo include environmental scans in both the literature component and interviews with subject matter experts that were included as part of the scan. In policy review, to scan dozens of policies, compare definitions of terms across the policy, and to see how consistent the definitions were or were not. In longitudinal survey data about patient experience with the healthcare system, in evaluation, as example, providing healthcare provider survey data and combining it with interview data in a large network of various agencies organized around children's services. And also some examples of quality improvement, whether it's to assess the themes logged in patient concern calls that could be analyzed over time and geographically by hospital site or unit. Or in another example, we used NVivo to support collaborative strategic planning of QI work. So I'm just going to switch us now to NVivo. So first, this is what NVivo looks like when it's open. And let me show you around NVivo and introduce some of the terms. Right now, you're seeing multiple windows open in NVivo, and we have some features that I find really handy and some terms that might be new for you. So on this side, the left-hand side, we have a number of folders for organizing your project materials under sources. We also have a folder for memos, and memos are used for keeping notes about the project and the analysis. Another part of NVivo and where the language might be new to you are around nodes. And these are areas for organizing the data, where you can organize or code the data by groups, question responses, topics, themes, and so on. And then depending on the version of NVivo you purchase, other features that help you think about the project could be maps, which are available under this Explore tab in NVivo Pro and Plus. Auto coding, which is really handy when you want to get a quick look at the data. Auto coding is available under the Analyze tab. And queries. And queries are the questions that we use in NVivo to ask questions of the data, drive your analysis deeper, and so on. And of course, NVivo has a lot of features to help you visualize the results of your coding or your analysis, such as charts, comparison diagrams, and so on. And I'll be showing you a little bit more about some of these features. Now, usually when I'm working in NVivo, I create a separate NVivo project for each piece of work that I'm doing. For instance, I would have all of the information, documents, data, and analysis for my health policy project in one project. And if I had another project going, let's say about an environmental scan, I would store all of the information related to that piece of work in its own NVivo project. But for the purposes of today, I put all of my examples in the same project just to minimize how much I switch screens. So that's a little bit about how NVivo looks and some of the terms that we use. And you can see that by going back and forth across the ribbons, you get different options and different tasks. And I would like to illustrate now how I might use NVivo if I was starting, let's say, a health policy project where I wanted to do some analysis of health policies. So if I was doing this as a new project, of course I would open a new blank project in NVivo. I would then go to sources and I would create a new folder for my policy documents. So now I have a new folder and I would like to import the policies that I've gathered into it. Now, prior to this demonstration, I actually did a search on the internet for policies, and I was looking specifically for privacy and health information policies. So in my new folder, I can navigate to the place where I have stored the policies. So I have a folder called policies, and I can open that and import all of the policies I found into NVivo. And when I do that, it leaves a copy of the PDF documents or documents or sources in the folder where I was importing them from, and makes a copy of them and brings them into NVivo. So now you can see that all of the policies that I had found and stored in the folder on my desktop are now imported into NVivo. One of the things that I noticed when I was actually doing this search was that some of the policies were not available as PDF documents. In fact, they were only available as web pages. So what I also did, and you can do in NVivo Pro and Plus, is to use the capture feature of NVivo to capture those documents from the web page. And I also can bring those into NVivo using the capture feature. And you can see here that they have been stored in a folder. I can import those web pages also into the same policy folder that I have already created, and they will be available for analysis. If you notice at the bottom of my screen, I can see the green bar telling me how close it is to finishing importing, and at 100%, I now have both the PDFs that I had found originally and some of the other policies imported. And let me just show you what these look like once they're imported. So this was one of the original PDFs. And it opens, and I can have a look at it and start to code on it. And one of the other ones that was a web page comes in, and it looks kind of like this. This is a real life example of how I could and did do a search for these documents, bring them into NVivo, and so on. Now, once I have documents in NVivo, what I usually do is start to read them and then code or gather all of the information about a certain topic that I'm interested in into a node, or that area I talked about where you want to collect items of the same topic. So let's say I'm interested in consent. And I've scrolled down, and what I might do then is open up my nodes, and right now I have no nodes created. I would select text, and I'm going to create or code a new node, and it's just taking a minute to load. It's slower when we're working over the webinar platform. So I want to create a new node called consent. And you can see a node is created, and if I open the node, it shows me the text that I have just coded, and it also references the document it came from. Now, this kind of process is the traditional way we did coding when in the early days of NVivo, and it's still, the manual coding is still essential to doing your work. But sometimes there is a much quicker way to get some of the terms gathered in one place or nodes, and you can do that by generating a query. So let's say, knowing that I'm interested in doing a query, interested in consent, I could create a query called a text search query that would allow me to search for that word consent in all of the documents that I am interested in finding it in, or in this case, in all of the policies that I imported. So I'm going to look for consent in this search. And I'm only going to look in my policy folder. Remember, I said I have a lot of different documents in this for the purposes of illustration, but I'm only interested in looking in the policy folder. And I can also select how much text surrounding that word I want to come in, and I'm going to just bring in a few words on either side, or a narrow context. Now I can run this query and see all of the places that NVivo finds consent in all of those policy documents. So it's just running now. And this bottom window, I'll just pull it open a little bit so you can see a bit more, shows me all of the places, all of the documents where NVivo found the word policy. For instance, in this document, it found it 10 times. And if I open the document, I can see having that search done is a quick way to gather all of the references to policy. But you'll notice at this bottom number here that that generated about 300 references. And that might not be a fine enough search or a refined enough search for what I want. So the other part that I can do, I can save these results as a node. And I like to name my nodes by the way I found them. So if I did it as a text search query, I would limit it this way. And all of the results that I just found would be in this new node called text search query consent. And you can see that it's got 237 references. That's a lot of information to search through. So if I actually wanted to refine that search, I could run a different search where I refine the terms a little bit more and not and bring something in that's a little more manageable. So let's say one of the things that I'm interested in is actually looking for implied consent. I can do a search for a phrase, bring it in as a narrow context. I selected only my policy folder, run this query. I think it's running in the background. Let me try one more time. There we go. So you can see that this search turned up about 14 references. I can tell that by this number at the bottom. I can also save those results. And perhaps I want to save those results as a subset of my consent node. And I could save it on here. And it would come in as a sub node under my consent node. So using text search queries is a way to help you quickly understand some of the information that's in your data without reading all of it. So I might still want to go through and read for other themes, but it quickly allows you to get to a whole lot of information in one node at one time. So in a similar way, if I was bringing in literature and was doing a literature review and so on, I could also bring in the data, and I'm just going to go back to my literature folder, and prior to this demonstration, I gathered a number of pieces of academic research literature and brought it into a folder. And this time I was interested in patient-centered care. So if I have all of my articles here, let's say I wanted to know quite quickly what words were most frequently used in my articles. If I wanted to do that, I could run a query and a word frequency query. And a word frequency query simply goes through all of the documents that you've selected and allows and counts up the number of times words are used. So I'm going to select this time my interviews folder, or sorry, my literature folder. And I'm going to look for the 100 most frequently used words across all of these articles that were part of my literature set around patient and centered care. And I'm going to run this query. Now the results that are returned when I run a query like that, and I'm just going to pull this open a little bit more, produces a table. And by default, the table is arranged with the most frequently used words at the top. So because I was searching specifically for patient-centered care, it's not too surprising that the words care, patient, centered, health, and so on are the most frequently used words. And in fact, if those words were not something you wanted to kind of represent because you expected them to be there in a high frequency, you can actually remove those from the search and look for the search again without those words. But for now, I'm going to leave these frequently used words here. And in this example, in this study, I'm interested in outcomes. Now, I can rearrange these lists alphabetically, and I can look down to see if outcomes was mentioned very much in this word frequency. And when I have a look, indeed, outcomes came up 187 times. So right from here, if I wanted, I can run a text search query to find all of the references to outcomes from studies. And in fact, I can have a look at the study and see where found. And just as before, of course, I could save these results as a node and so on. So I wanted to show you this example. The actual searching is a similar process to the searching that we used in the policy example. And I find that combining text search queries and word frequency queries is a great way to begin to understand your qualitative information or data before you even read it. I use the queries to find out about the commonly used terms or the authors that are frequently mentioned and so on. And I'd like you to also note that you can bring in literature that you might have already gathered in bibliographic reference software such as EndNote, Mendeley, RefWorks, and so on. And you can bring those and their classifications, where they came from, and all of the notes that you have about them into NVivo. So just, starting to think about the many ways you can use NVivo, starting with your literature before you even have data, is something to consider. I'm going to switch us now from document types of data to survey data. And in this survey data, I have a data set gathered from a project that I worked in, where surveys were gathered from patients who were recruited to a hospital, from a hospital after having a heart attack or myocardial infarction. And they were followed at regular intervals up to 1 year to understand the differences in some outcomes. Data was gathered from them at baseline, 1 month, 6 months, and 12 months. Most of the data was quantitative and analyzed using statistical analysis software, but the comments and other open-ended questions were extracted from the larger data set into Excel spreadsheets, which we imported into NVivo so we could do the coding of that kind of data. We were interested to see, for example, what changes people had made in their lives since having the heart attack, and interested to see if these changes differed among certain characteristics, such as gender, income level, and so on. Now, in NVivo, the general term used for individual survey respondents is called cases, and each respondent or participant from the survey is a case. And in NVivo, you actually create a special set of nodes for each case where I can house all of the data related to that case. And in fact, NVivo builds in a handy sheet for analysis purposes that tracks various variables or attributes for each of the participants, and I can add to that case data over time. So I might be interested in where they were born, their ethnicity, whether or not they're male, female, their age, and so on, or even brought in their status of having completed the survey at certain points, and so on. Now in this project, I want to add data to a case each time I bring in the next set of data. That is, I wanted to bring in the data at time 1, at baseline, at 1 month, 6 months, and so on, and have the data for the same participant be gathered at the same node or case node that I just showed you. So you can see in this example that I've already imported all of the relevant data at baseline, 1 month, 6 months. And if you have a look at that data, it looks like a typical spreadsheet looks. There are my participant study IDs, and here is a list of some of their comments. And I wanted to do analysis on their comments. So what I want to do now is show you what happens when I import the next set of data, or the 12-month data. So I'm going to go to the folder that I have stored that data. My 12-month data in an Excel spreadsheet, and I'm going to bring it in. Now, NVivo 11 Pro has a handy data import wizard that really helps with how easy it is to import this kind of information. And it gives me some pictures and notes for me to follow. So my respondents are going to be stored as cases. The closed-ended questions, such as demographics, where people live, and so on, sometimes called categorical variables, they are going to be created as case attributes, and my open-ended questions are going to be created as nodes, and that allows me to code on those nodes. So I'm going to accept all of those things, and then NVivo has a look and gives me a preview of the data that it sees in the sheet that I selected. So here you can see my study ID, the open-ended question for the changes post-heart attack, impact on life, and so on. Some of the other demographic variables were imported with the data at earlier stages, so we don't have to include those again here. As long as the study ID is consistent, it will match the data for this participant, number 4, with the case node for number 4 and those variables. I'm going to actually just store this data as part of my case nodes. It asks me if people are being identified by study ID, and it is. And it actually even gives me an option to change. If this wasn't a closed-ended question, I could import it as an open-ended question, and so on. So it goes through variable by variable, and I can even choose not to import it if I wish. So I'm going to finish that. And you can see NVivo giving me all of the prompts, and it said it imported the survey, created cases for the survey respondents, created case attributes for the closed-ended questions, and it created nodes for all of my open-ended questions all at once. For those of you who haven't used NVivo for a while, you might be surprised at how easy it is now to bring some of this stuff in. It used to be very different. So here is my spreadsheet and what it looks like. You can see some of the responses there. And now let's go to the nodes and see what NVivo coded in those nodes automatically. I'm going to go back up to my 12-month nodes, and I can see the two open-ended questions. Here is one, impact on life. That was one of our columns that came in. And I'm interested in the changes node. What people reported changing 12 months after they had a heart attack. It doesn't take us long to see that things that are commonly reported are diet and exercise. Just a quick scroll down this node, you can see lots of references to diet and exercise. So one of the first things that I might want to do is run a word frequency query for this node. And I can do that right from this screen. I'm going to run the word frequency query that I showed you before. And no surprise that diet and exercise are topping that list. And then, if I'm interested in capturing all of those at one place, I, of course, can store this as a node, but I'm also going to run a text search query for diet, and I'm going to put all of that in one node called diet. And similarly, I could run a text search query for exercise and put it all in one place. And if I go back to my nodes, I can see that all of those references are captured there. And this becomes a great way for me to now start doing some comparisons. Let's say if I wanted to see if males mention diet more frequently than females, or exercise was mentioned more frequently by people of different levels of socioeconomic status, and so on. And of course, I can still go back to my original 12-month data and read down through all of the items in this column, or in the, actually I'm going to go back to the nodes. That's a better place to do it. And we had them in our 12-month nodes. I can still go through and read and code for other kinds of themes. So I might run these kinds of queries like word frequency queries and text search queries and so on, but still do some of the theming. So the last thing I wanted to show you from one of these word frequency queries was something called a word cloud. And when you run a word frequency queries, one of the visualizations that NVivo allows you to do is a word cloud. And if you're not familiar with word clouds, the size of the font actually represents frequency. So the bigger the word, the more frequently used the word was. And these pictures were really interesting when we started to compare changes that people reported at 1 month, 12 months, 6 months, and so on. Diet and exercise got bigger and bigger as the months went on. So I hope with this example you can see how you can work with survey data, you can combine different data sets from longitudinal data, and really handy if you've got a survey that you run over and over again, let's say a quarterly patient satisfaction survey or something like that, you can start to build these over time. And then do comparisons, not just between different characteristics like sex and gender, but also over time. So I'm going to switch us now just briefly back to my PowerPoint slides and talk a little bit about other places that we can use NVivo. And I'm going to show you some of these in just a moment when we go back to NVivo, but you can use NVivo in project planning, longitudinal work, as I just talked about, in patient satisfaction surveys. I use NVivo to track the analysis methods, the time and the resources we spent in qualitative analysis and so on. And if you happen to have NVivo 11 Plus, you can even use it to do social network analysis. And you might be interested, let's say, in capturing changes in social networks before and after a change initiative or a major program change to see if the relationships between people have changed. So I'm going to switch us back to NVivo in a moment and talk a little bit and show you how I use this at different stages of the work, whether it's scoping and planning a project or a grant submission, manage the project documents, collecting the information and data to do analysis, of course, and a bit about how we do synthesis and reporting. I'm going to switch back to NVivo. So for scoping and planning, I have found that the new maps available in NVivo are really, really handy. You can, using the Explore tab, create mind maps, project maps, concept maps. They all have a little bit different purposes. But in the mind map, you can brainstorm ideas, let's say as part of a team meeting where you're wondering about different topics that might show up in your data before you even have data. And in this example, I was thinking through some of the changes that we anticipated in that heart attack data and things that people might report, lifestyle changes, diet, exercise, and we were wondering whether that varied by sex or whether there were changes over time and so on. So these mind map bubbles, if I was interested and we agreed as a team that those were going to be potential topics, right from here I could create those as nodes. And by the way, you can export these mind maps as JPEGs or documents just to include in reports and slides and so on. So they can be exported from NVivo and used to support other work. And I didn't mention, but you can also do the same thing with word clouds. So word clouds can be exported as picture files, used in presentations, imported into a PowerPoint slide, and so on. And I'd like to finish today with an example of how we used word clouds really effectively in a big project. So the other thing that I really like NVivo for is managing all of the documents related to the project. So in my sources, you can see I have a folder here for project documents. And inside that, these are real examples from a project, the project that was about analysis, evaluation of a children's network. And there were many, many different groups supporting that network. And we had some focus groups, and I imported the consent form, the questions, a sample of the transcript, and so on. And then these brainstorming documents were just with various team members along the way when we were thinking about what would happen in the data. Another area of NVivo that I use extensively and I think is essential to good analysis is the memos. And we use memos to track hours, so how long it takes to do things like coding the interview, and how long it takes to code the first interviews versus the last interviews, and so on. This is really handy both to track the use of resources in the project, but I found it really helpful to use these memos when I'm planning other pieces of work. So let's say I'm doing a grant application or I'm getting ready for a next project, I can look back at some of the hours and the work that we did to estimate how much time we might spend in the next project. And it's all in place with the project that we did it on. And we use memos, of course, to keep track of our thoughts about the themes that are developing. We have notes to each other when I'm working with other team members. And we also keep notes about certain items that will probably change as time goes along. So we might have a node called communication. and we think it might need to be divided into other nodes, we can keep notes and in memos about what we are thinking about that. And by the way, memos can be exported as Word documents and be very handy as you start to do reporting. Of course, you know, we use the folders to organize the data. So in the project I mentioned, we had focus groups and interviews, and they could all be in their own folder. And in fact, in that analysis, we also had survey data that came in and was part of the data set that we used going forward. Data analysis, I've talked a lot about. That's NVivo's initial use and what it's still really excellent at doing. But I'm hoping to show you that by this, these features, it's not the only use for NVivo. So for synthesis, which for me is the process of moving from the analyzed data to themes and a summary of responses to the questions we were asking and so on, I find NVivo allows you to pull the results of the coding and queries into patterns, and you can use the iterative process going back and forth between manual coding and querying and keeping a memo of the search terms that you want to look for and so on. And when you're keeping notes about it as part of your memos, it allows your process to be very transparent, or if you're like me, just help you to remember what you actually did during the project along the way. One of the things we find most helpful about memos and where I often use them is to keep track of the quotes as we go along with the quotes. So you can see here, this is what a memo looks like when it's open. It's just like a Word document. But if I open this, I've put in a link to one of the quotes that we thought was really important, and I can jump right to that quote by clicking on this link. Usually, we're going to open. Open to item. There we go. So that was the quote that I attached there. When I export the memo can export bringing the quote and where it came from along with it. And that's really handy as we start to write up our results. So I'm hoping you can see that NVivo really helps you start to keep all of the information related to one project in one place in a very tidy way that you can go back and retrace your steps. NVivo is stored as one file that could be password protected, so you can store it on a server, in a secure server, even use password protection if that's important to you, and so on. And then, of course, all of these things can be used to pull together to do reporting on the features of NVivo, using the features of NVivo that really interest people in the data, such as the word clouds or some of the other features like the charts and mind maps and so on. I'm going to finish with an example in just a moment of how we used it in a very large project to interest people in the data. But before that, I'm just going to switch back to my PowerPoint slide and talk a little bit about how NVivo, I believe, is used in healthcare settings to improve efficiency, effectiveness, quality, and teamwork. So, you know, in thinking about some of the examples I've just shown you, and I'm hoping you're starting to see some of the applications beyond research that might be helpful to you in your work, in my experience, NVivo really can improve the quality of qualitative data work and in various ways. So first, in terms of efficiency, the important project documents and data are collected, analyzed, and summarized within one project, rather than in multiple folders, files, and on other people's personal drives and so on, which doesn't work well when people move on. These can be stored in a location accessible to all team members that require access, for example, a private group folder on a shared drive or a SharePoint site, and it can be even password protected. Team members can work on copies of the same project on their own computers, depending on the license agreement, then merge the copies back together, compile and compare their work, increasing the quality by developing consistent topic definitions and theme content. That improves inter-rater reliability and really gives you transparent processes by which the themes were developed. The project framework, or the node structure, can be imported into a new version of NVivo from other projects. So if you've been working in a series of projects and you have a really great node structure that's worked well and you want to continue to use it, you can do that. You can bring it in without the previous data, but just the node structure. And that really becomes a foundation for new work. Or you can adapt it and use it to compare results over time. So going back to that longitudinal work, or something like a patient satisfaction survey that's used over a number of iterations, you can bring in the results and compare them over time. And with NVivo Pro 11 Pro and Plus, you can increasingly teach NVivo to automate the coding within themes that are very consistent. And so it can become more and more adept at auto-coding some of those themes for you. And NVivo also allows you to export the list of nodes and the definitions that you've put in as a code book, which can be really useful as you're training new people on what goes into each of those nodes if they're doing the data gathering for you. I really think NVivo increases the thoroughness with which data and information are reviewed. When I'm looking at things and doing manual coding, for instance, I open a memo and I call that memo search terms, and I simply write down any words that seem to be recurring a lot, and I keep a big list of text search query terms that I want to use at a different stage, but I don't want to get too sidetracked by that at that point. And late in the day when I'm tired, I go back to my search memo and I just do some text search queries for those terms and see how often they're actually coming up. So, and of course, you know, by having interview and focus group data in a place that you can match it with the survey results and your literature and so on, I think really improves the linkages that you can make between those various pieces of data, strengthening the quality of your work. So that's a little bit about how I've used NVivo and with other people in these projects. And I'd like to finish with an example that is a real-life example for us. I was working with a large team of people in a healthcare setting, and we were doing a big environmental scan about patient and family-centered care. And this environmental scan had a literature review component, and it also had over 25 focus groups with healthcare providers, patients, families. We had, in fact, over 325 participants by the time we were done. Now, in this environmental scan, we had multiple layers of reporting. We were reporting up to a working group and a steering committee, and we also had an obligation to report back to the healthcare provider groups and the patients and families that participated in the focus group. So working with those, yes, we always want to say what we have done in NVivo. So working with those number of people in a team and so on, they were helping gather, analyze, and report on the data. And as we were getting ready to do our first interim report, just almost by chance, I included one of these word clouds as part of the report. And I explained to the steering committee members that were composed of patients and family members and healthcare providers that the size of the font represents the frequency with which the words were used. And this is actually a word cloud from one of the focus groups that we did, and it represents the most frequently used words in the notes from their data. So when I was explaining that and saying to the people on the steering committee that we actually found time was very frequently used, and we thought that time was going to be an important theme in the data, one of the patients on the group asked me, he said, Laura, I can see that time shows up frequently here, but you're just showing us at this point healthcare provider data. Is that right? And I said, yes, that's right. It is data from healthcare providers. And he said, well, I can see why healthcare providers would use the word time a lot, and they did. You know, it takes time to provide patient and family-centered care. We'd like to do more of it, but it takes so much time and so on. And he said, I can see how people would do that, but I'm not so sure that when you have the patient and family data, you will see the same number of references to time. Now at that point, although we hadn't included it in the analysis, we actually did have some of the patient and family member data, and I knew that they also used the word time quite a bit. But of course, patients and families were using the word in different ways. So patients and families were saying, we don't get enough time with the healthcare providers, we have long wait times, and so on. So I like that example because it shows us that the frequency with which a word is used is just the first clue that drives us back into the analysis to talk a little bit more about how certain terms are used, and we're not finished by simply reporting how frequently certain words are used. So you can see in this example other things that these healthcare providers used, talked about were support, physicians, clinicians, referrals, waiting, and so on. Now, this is a snapshot of some of the word clouds from some of the other focus groups, because here's what I found. Despite the fact that we spend hours creating themes, and I personally love the themes, I found that people are not always as thrilled as I am with that kind of data, and they are less impressed by the theme, and yet when they see these word clouds, they love them. So having observed that, and when my ego got over the fact that I wasn't they weren't as interested in the hours I spent on the word cloud, on the themes, but they sure loved the word clouds, I got over that, and I started to use these word clouds in lots of areas of that work, and together we pulled each of the word clouds from the focus groups, and they became the illustration for the cover page for the reports that went back to the focus groups. But they also peppered the report that went back to the steering committee, and you can see that time shows up in most of these word clouds as a really important, frequently used word in all of those word clouds. So it did still continue to be a frequently used word, but when we reported on the theme, we reported the different ways that people were using that word time. So I hope that gives you a little slice of how the visual features like the word clouds can interest people in the data, which then helps them understand and validate that the sense of the theme by what they're seeing and observing in those word clouds. And no matter how much time I spend on the theme, these word clouds and other visualizations are always the most important feature, most interesting feature of the report for those stakeholders. So I'm just going to wrap up now, and I have provided my contact information, Laura@groups.work, so watch for the S between group and work. And just hope that I've set out to do what I said I was going to do. I showed you a little bit about where NVivo can support a variety of activities of analysis, such as environmental scans, policy review, evaluation, and so on. And at different stages of the work, yes, we use it for analysis, but it also, NVivo is a place to do most of your qualitative project work, housing the project documents, and so on. And then how I believe NVivo supports efficient, effective teamwork and really allows you to do quality quality piece of work by tracking your methods and being able to document that and report on that. So Kevin, I think that wraps up what I had hoped to say, and wondering if you have any questions for me.
Thank you, Laura. And thank you everyone for attending today's webinar.